I would like to introduce our speaker for our neuroimaging session that we chose amongst a set of abstracts that were submitted, and it is Alan Seifert, right over here. And he is a postdoctoral scholar in Gordon Zhu's lab, and they are working on some really interesting spinal cord imaging work. And Alan is going to speak about DANTE-EPI for CSF suppression in cervical spinal cord bold fMRI at 7T. So, thanks.
Well, thank you very much for selecting my abstract. All right, so as Preeti said, I'm going to present our work on a method to suppress signal from cerebrospinal. I'm going to present our work on a method to suppress signal from cerebrospinal fluid to improve fMRI in the spinal cord at 7T. So we're all very familiar with how many fMRI studies are conducted in the cortex. So why aren't more studies done in the spinal cord? It's certainly not because it isn't an interesting structure. It's far more than just a bundle of white matter tracts. There is gray matter in the spinal cord, and within this gray matter are some very interesting circuits that we'd like to be able to study. For instance, there's the withdrawal reflex, where you retract a limb from a painful stimulus. That occurs in the spinal cord. Pain signals are also modulated within the spinal cord based on descending input from higher centers in the brainstem and simultaneous non-painful input from the periphery. And there are also balance circuits that act in the spinal cord that receive proprioceptive input and connect this to motor output. So given that there are these circuits in the spinal cord that we want to study, the question becomes, why can't we use the same methods that are used so successfully in the cortex, the echoplanar imaging sequence that's standard for fMRI studies? And the problem really is the small size of the spinal cord relative to the cortex and the comparatively low resolution of echoplanar imaging versus these high-resolution anatomical sequences that we have. So we need higher resolution in EPI to perform fMRI in the spinal cord. And we accomplish this by moving to ultra-high field, to 7T, and also by using a specialized custom-built brainstem and spinal cord radiofrequency coil. And aside from this, there are some other problems that we have to contend with in the spinal cord. There are a lot of other sources of signal nearby the spinal cord because it's in the neck, it extends down into the torso and the abdomen. So there's a lot of other signal that we need to contend with. And there's also a separate issue of magnetic field inhomogeneity due to the vertebral bodies and the lungs. These all perturb the field, and these are very difficult to correct for by traditional shimming methods. But this problem and then the solutions for field inhomogeneity are outside the scope of today's talk, so I'm going to be focusing mostly on the suppression of unwanted signals. So, as I said first, there's a lot of fat and other soft tissue in the neck, and the spinal cord sort of exists right in the middle of all this. So we normally phase encode in our API sequence in the anterior-posterior dimensions. So we'd want to actually reject this soft tissue so that we can reduce our field of view in the phase encode direction and use that to shorten our echo train length and accelerate our acquisition. So we already have a solution to this, and it's a spatial and spectral saturation. So these are very, very standard and very well known. So the general idea is we add some preparation pulses before the imaging kernel to spatially and spectrally saturate and remove signal from these unwanted tissues. But the cerebrospinal fluid is a different story. This fluid exists surrounding the spinal cord. It's very close and it's very bright. So just by way of a quick technical introduction for those who aren't familiar with fMRI, what we do in bold fMRI is we track a blood oxygenation level dependent signal over time, and use changes in the signal to infer neuronal activity. So what we're interested in is change in signal over time. But if we have this cerebrospinal fluid right next to the spinal cord here, which is also pulsating on the cardiac cycle, this induces some time fluctuating signals, and this can overlay, can bleed into or alias into the spinal cord, and it can cover up this neuronal origin, blood oxygenation level dependent signal that we're interested in. So this CSF has it presents two problems. Because it's moving, it can alias, and also because it's moving right next to the spinal cord, it can actually push the spinal cord around slightly and cause small motions. So both of these are nuisance signals that we need to deal with. And there are ways to regress these signals out in post-processing, but I mean, it could be even better, and it likely is even better to just not acquire the CSF signal, reject it at the acquisition stage. So using the same general idea of a preparation module for selective saturation, we want to insert some module into our sequence to reject this moving cerebrospinal fluid. And the method we chose is delays alternating with nutation for tailored excitation, or DANTE. So Lee et al. At Oxford developed this method. This is actually a pretty old method, but Lee et al. Developed it to make it a motion suppression method. And they demonstrated this in black blood vessel wall imaging and anatomical imaging of the spinal cord. So what we did here is combine DANTE with an echoplanar imaging sequence and assessed its performance using some fMRI metrics. So the DANTE method itself is a series of non-selective low flip angle radiofrequency pulses interleaved with these gradients that are along the direction of the flow that we want to suppress. And this this is placed before every imaging readout kernel. And if you look at this, it sort of resembles an unbalanced, steady-state free precession sequence, just without any readouts, for people who are familiar with that. So static tissues like the spinal cord itself reach a steady state. There is some attenuation, and it's dependent on the number of pulses in this DANTE train and the square of the flip angle alpha. But we see here in this simulation, again by Lee et al., that the moving spins are attenuated rather strongly, and after some transient, they reach a pseudo-steady state. So all of these moving spins do eventually get saturated to relatively the same level, but depending on how quickly, the velocity of these spins, it may take a shorter or longer time for this pseudo-steady state to be reached. But fortunately for us, the peak velocity of CSF in the spinal cord is in the range of 1 to 10 centimeters per second. So this is well into the range where DANTE works. So by placing this prep block into our sequence, we can suppress the moving CSF signal, preserve the static spinal cord. So just a disclaimer, these images are windowed differently, so what I'm showing here is the contrast. But in this montage here, these frames are all windowed and leveled on the same scale for comparison. So these images here show the effect of DANTE in EPI images at the C4 vertebral level of the spinal cord at various pulse train lengths and DANTE flip angles. And the important thing to note here is that the CSF is attenuated rather strongly, but the spinal cord, the signal in the spinal cord, is also somewhat suppressed. So we quantified this effect of DANTE in several ways, and I'm going to be referring to these regions of interest over the next few slides. We have the right and left gray matter and the cerebrospinal fluid. So the registration between this high-resolution anatomical and the comparatively lower-resolution EPI images isn't perfect because of this difference in resolution, but these ROIs are chosen very carefully to exclude any partial volume effects. So that's really the reason why these are so small, these ROIs. So first and most simply, we measured the absolute signal intensity within the left and right. This is the sum of the absolute signal intensity in the left and right gray matter, and also the signal intensity within the CSF. And we plotted these against these two DANTE parameters, the flip angle and the pulse train length. And as we see here in the surface plot, as DANTE becomes more intense, as we ramp up these parameters, the CSF signal is very strongly attenuated, while the gray matter signal is somewhat more modestly affected. So by way of numbers, at our strongest, 250 pulses at 15 degrees DANTE preparation, signal in the CSF is attenuated by 95%, whereas slightly more conservative DANTE preparation of 150 by 15 or 150 by 10 achieves 92% and 80% suppression of CSF respectively. But as I said, the signal in the gray matter is also attenuated somewhat, and this is unwanted attenuation. So at our very strongest DANTE, it's 42% attenuation, and moving down to 34 and 26% at more conservative DANTE. And again, this attenuation of static, non-moving signal is proportional to the number of pulses and the square of the flip angle. So next we looked at the temporal signal-to-noise ratio. So this is, because these are a series of 100 images, the temporal SNR is the SNR of the time course of signal in every individual voxel. So this is much more of a concern in the gray matter than in the CSF. We know that the CSF signal pulsates, so it'll be fluctuating throughout the scan. And this means that it'll have low temporal SNR to begin with. So we're not focused here on minimizing TSNR in the CSF. We're focused instead on preserving and maintaining the temporal SNR in the gray matter. And as we know already, the TSNR is decreased somewhat by DANTE, so this needs to be balanced against the reduction in the absolute signal intensity of the CSF. And finally, we looked at the temporal cross-correlation between the left and the right gray matter here. So since these were resting state scans, we expect that the signal in the left and right gray matter will be correlated because we're not having the subject perform any lateralized task. But the strong signal in the CSF may alias or bleed into the gray matter and overshadow this correlation. And that's what we see here. So first note that these axes are reversed in this last surface plot. So at no DANTE, we see a very low correlation between left and right gray matter. But as DANTE is ramped up and the CSF signal is suppressed, we end up seeing a rather strong correlation between left and right gray matter. So this goes from an R of 0.25 up to the range of 0.8 to 0.9. Oh, excuse me. So we can look at this another way as well, comparing or looking at the temporal correlation of gray matter versus the CSF rather than left and right gray matter versus each other. So with DANTE off, gray matter and CSF temporal cross-correlation is 0.54, but as we ramp up to full DANTE, this correlation drops down to 0.08, a very low level. So this, again, supports the notion that with no DANTE preparation, there is signal spilling from the cerebrospinal fluid into the gray matter and overshadowing the signal we're looking for. But as we suppress this CSF signal, this nuisance signal in the gray matter is removed. So to sum this up, the CSF contributes a confounding signal that complicates measurement of bold signal in the spinal cord. So if we suppress this nuisance signal, this bold effect becomes more directly measurable. But because this preparation takes scan time, it deposits RF energy and results in some static tissue suppression, because nothing, of course, comes for free. These parameters need to be tuned very carefully to achieve the proper balance. So And again, I'll just say this again, another disclaimer, that DANTE doesn't deal with the small amount of motion that may be induced in the spinal cord itself by the pulsation of CSF around it. So, this doesn't replace the post-processing regression of physiologic variables. It just makes the whole sequence and the method as a whole more robust to the flow of CSF and the aliasing and the signal contributed by the CSF itself. So overall, this DANTE-prepared EPI is a promising technique for bold fMRI in the spinal cord at ultra-high fields. So just want to thank all the funding and my mentor in the lab, in particular Beijing, for building this 7T spinal cord and brainstem coil that made all this much more possible. And thank you all for your attention.
Thank you so much, Alan. We are open for questions.
So it's known that the preparation you're using, the unbalanced steady state sequence, has a diffusion weighting associated with it. Do you have any idea how much that is, and if there's any differential attenuation of your gray-white matter, for instance?
I mean, it certainly is possible, but if my slides are still up, so if I go back to this simulation, these DANTE preparation modules, more unwanted input, sorry. These DANTE preparation modules, this is a simulation, so this extends quite a bit longer in time. When we actually apply these, it's more in the range of 0.6 to 1 second. And I mean, the motion, the velocity of spins in diffusion are sort of well below the sort of sensitivity, or well below the level at which this DANTE will affect them. So we think this is probably a very minor effect. Our bigger worry is whether the CSF is moving fast enough for us to suppress it.
Well, you did show that there was some reduction of the signal in the cord itself. So do you think that's due to another effect, not diffusion?
It would be more like reaching a steady state in a balanced steady state free precession. So even if the spins are absolutely stationary, even if they're not diffusing at all, they'll still experience this attenuation just because they're reaching a steady state as the DANTE is played out.
All right, thanks.
Mm-hmm.
Any other questions? I guess I have one, Helen. So is this effect kind of exacerbated at 7T versus 3T, or what would be the advantages of using this in higher fields?
Well, I don't believe DANTE would actually be any more effective or have any stronger effect at high field, but the problems that DANTE is meant to address here, these confounding variables, these nuisance variables, are more severe at high field. So it really, moving to high field is necessary so we can get this increase in resolution to even think about performing fMRI in the spinal cord. But all the problems that come along with this shift to high field, they're more severe, so this really makes DANTE more important.
Great. Thank you so much. This is a certificate and a little gift for you.
Thank you.